All right, I think we'll go ahead and get started, and as people join, then we'll let them into the event. But thank you so much for joining on the last day of the Bay Area Science Festival. I'm really happy to have you all here. This is Storytelling During a Pandemic. My name is Farah Hamadi. I'm going to go ahead and share my screen so we can get this workshop started. So welcome everyone. So this is Storytelling During a Pandemic. My name is Farah Hamadi. I'm with the UCSF Library and Makers Lab. I am the UCSF Artist in Residence at the moment. This will be a 1-hour workshop. So for today, I'm going to do a brief introduction to who I am and the field that I work in. We'll dive straight into the workshop, going over different storytelling examples during the COVID-19 pandemic. And then we'll do a brief comic exercise at the end. Hopefully you have a pen and paper ready. And then we'll do some Q&A at the end if there's time. And hopefully if anyone would like to share the comic that they draw, I'll share mine. We can have time for that at the end as well. So really briefly, I'm a medical illustrator and animator. I recently completed a master's degree at the University of Toronto in biomedical communications. This is one of 4 master's degrees that are accredited through the Association of Medical Illustrators. And the field of medical illustration is pretty niche, but it's also very broad in the kind of work that we do. So for me personally, I do illustration work, I do 2D and 3D animation, and I also have done projects in graphic medicine, which is a branch of comics and graphic novels that deals specifically with healthcare topics. So as a medical illustrator and animator, we work on all sorts of different projects, either with surgeons or with medical schools or patient education pieces, basically any kind of project revolving around describing sciences and healthcare to all sorts of audiences. So it's really fun to be in this field, and if anybody has questions about this at the end, I'd be happy to answer them. As a medical illustrator and animator, I am doing a lot of ideation and research before I do any kind of production work for these kind of projects. That means that we're doing research on who our audience is going to be. We're doing research on the science itself. So right now, we're in the middle of a pandemic. There's been a lot of new research coming out. So as people in our field, we are kind of synthesizing all that information, and we're helping break it down depending on the audience. Is it for children? How do we target that audience? Is it for other scientists? What kind of information are they going to need to be visualized? So for all of these projects, there's a lot of research and ideation that goes into it. As the UCSF Artist in Residence, working with the Makers Lab and UCSF Library Archives to create a project that is at the intersection of the sciences, the humanities, and the arts. So during this pandemic, I've had to change the project quite a bit, and I'm also doing a COVID storytelling project. And this project is called The City is a Body, Systemic Vulnerabilities in the Time of COVID-19. Basically, I'm looking at existing disparities that have always existed in San Francisco and how those disparities have exacerbated COVID outcomes in the Bay Area. So the project is ongoing. It's still in the ideation research phase at the moment, and this project will wrap up in May. But it's going to be one of many amazing storytelling projects that have come out of this pandemic. So what is science storytelling? So within medical illustration and animation and this whole field, there's a certain subsect of it that deal with science storytelling. So the purpose of science storytelling is to help communicate difficult topics. So whether that be the complex science behind a new type of research. So in this case, we're looking at the COVID-19 virus. There's a lot of new research coming out. And our job is to help describe, all this research, all this jargon, all these medical papers that are coming out. How do we take that information and communicate it to a lay audience? So that's part of our job, to help visualize that. The other aspect of this is to help communicate sensitive healthcare topics. So right now, there's a lot of death and dying. There's a lot of difficult topics that we're having to face during a pandemic like this. So our job is to also help communicate those difficult stories that are coming out right now. It's not just about describing the sciences, it's also about describing the people that are dealing with those topics. So there's a lot of empathy that has to be taken into consideration when communicating those types of stories. So the purpose can either be to engage, educate, or to invoke empathy. So take the example of wearing a mask. How do we engage people in even reading about this, especially in the beginning of the pandemic? How do we get people to actually engage in that kind of material and public health information? The other aspect would be, how do we educate people on wearing a mask, washing their masks, why it's important to wear a mask? And then the other aspect is to invoke empathy. Why should I be wearing a mask in the first place? Is it to help the people that I love around me? Is it to help protect our community members? So all of these things have different purposes, and they're not necessarily mutually exclusive. And ultimately, science storytelling helps shape our perception of the world around us and inside of us. So it helps describe the science that we have in our day-to-day interaction, whether we're in the hospital or dealing with our health, and inside of us. So it helps to visualize difficult scientific topics that are happening in our bodies. So how does the virus, impact our health on the inside? How is it affecting our tissue? How does it, impact our lungs and our health? So, it helps visualize all of these aspects of science and healthcare. The types of media I'm going to be going over in terms of storytelling during the pandemic. There's all sorts of other media I could have covered, but in the sake of time, I'm going to go over still media, comics, audio, animation, and social media as an honorary mention at the end. And all of these types of media can serve many purposes for different audiences. So not one type of media is only associated with a certain group of people or a certain age group or audience. All of these can have a variety of different purposes. So to start off, I'm going to go over what has probably become synonymous with COVID-19 is this 3D render of the COVID-19 virus. So this is a 3D model created by Alyssa Ecker and Dan Higgins, two amazing medical illustrators and 3D modelers from the CDC. They work there full time. And this was created at the very beginning of the pandemic when we really had to create a face to the pandemic and what was happening around us. I think it's been amazing to see how this specific 3D render has just blown up everywhere. It's we see it in all sorts of different media now. And I think people don't understand that this 3D model, this was done intentionally with certain design decisions. So I like to call this, informed imagination. This is purely created from scratch by these two amazing artists, but there was a lot of information that was synthesized in order to create this 3D model. So with an interview with Alyssa and Dan, they said that the texture and lighting decisions that they had helped display the gravity of the situation. And what do they mean by that? So this kind of realistic granular texture that you see on the outside of the virus here, along with this more dramatic and realistic lighting, it almost seems like it's during the daytime. There's these harsh shadows that we see coming from the proteins on the surface. These are all intentionally done to make it feel like it's real and it's in front of us. And that kind of dramatic lighting also just displays that kind of gravity. This is a serious topic, and it should be taken. It shouldn't be taken lightly. Even the color combination they chose, these warm colors, so this red and orange, along with this more dull, muted gray as the surface of this virus, these are all intentionally chosen. So they said that this color combination they found the most arresting. So red is commonly associated with healthcare, with emergencies, with that kind of, like we should be paying attention to this, that kind of red. And the choice to then use a gray is to maybe display that this is a serious topic. So these two color combinations and the lighting and the texture, these are all intentionally done as informed artists who also really understand the science behind how this should be looking like. And it's been interesting. So we might ask, well, how does this one 3D render have to do with storytelling? Well, it's almost created an identity for the virus. It's created the main character for the story that we've been living through for the last 7 months or longer. We've seen it, all these design decisions of the red and gray color palette and the 3D model itself. We've seen it all over the news when stories and the numbers of the COVID-19 deaths and confirmed cases. We've seen it in all sorts of media outlets. Whenever it's being covered by any kind of news story, we're seeing this 3D model, we're seeing those colors pop up. So when we think of COVID-19, maybe the image that comes to the forefront of our mind is that 3D model. And that just shows how important it is for these artists to have created this model with the information that they had, as also being able to understand the science behind it. Another type of still media I'd like to cover is the infographic. So this is a great infographic done by Avesta Rastan, an illustrator based in Canada. It's called The Science Behind COVID-19. So this might look like a lot of information because it is. So this is meant to be taken, to be digested in stages. There's a reading order to this. There's a story behind how you should be reading this. You don't want your eye to jump between all these different things. You want to read it in the order that it was intended. And certain design decisions help us create that natural reading order that lead the eye naturally. So there's a lot of levels of information to this. You want to take your time reading it. This is probably more for an educated lay audience because there's a lot of difficult information displayed here. There's a lot of terminology that most people might not be familiar with, but it's presented in such a way that if you take your time kind of going over it, you'd be able to understand the story behind it. And I urge you to look at this in more detail at the very end at your own leisure time. So the important thing with an infographic like this is that the story is coming through the story arc, through this reading order. So we start off here with this more global view on what is COVID-19, how does it affect you as a body? Well, it's affecting the lungs mainly. So there's that kind of a larger gross anatomy aspect of it. And then it goes into the detail. Okay, well, if we zoom in here and look at the alveoli, well, then we're getting this progression that we see here. There's this natural reading order. We're going from a healthy alveolus to the infection, to a moderate infection. And then when there's a severe infection, what does that look like? And what's happening at each individual level when you're looking at the different cell types and how the virus is affecting those things. So there's that reading order here. And then we go into the immune response. So after we have this infection, what does the immune response look like at the body level? What's happening at the cellular level? And then it ends off with this almost bookmark kind of section at the end. Well, what can you do? So now that we've understood the science behind it, what can you do as an individual? You can take preventative actions. You can do things that will help you stay healthy. Where you can find some more information and where you can maybe donate to help alleviate this pandemic. One other type of still media is the narrative. So this is commonly seen through something like a comic. I think we often associate comics with being only for children or for a much younger audience, but in reality, comics can be used to describe pretty heavy topics as well. I wanted to show this example by an amazing Chilean illustrator who currently lives in New York. Her name is Fran Meneses, also called Franerd on Instagram and other types of social media. This is a comic called Frutilla. It's a 2-part comic on Instagram, and I urge you to read the whole thing. So this comic doesn't necessarily inform us about COVID-19. She's not explicitly stating COVID-19. It's actually the subtlety in this that caught my attention. This is a difficult topic for her to illustrate. This is her direct experience with experiencing a miscarriage. And it happened to also happen during the COVID-19 pandemic. So here you have compounding experiences of 2 already difficult situations happening at the same time. And it's the subtlety in this that tells us that this experience was happening during COVID-19. So if we read this comic 10 years, in 10 years, we look back and we read this comic and we don't have a date associated with it, we'd still know that this was happening during the pandemic, from the subtle everyday things that she's presenting from her experience. So, here they are, her and her partner are wearing masks as they're walking to the appointment. She's not saying that, oh, we're wearing masks because we're in a pandemic. It's implied by the fact that they're wearing masks in the first place. Here, she leaves him, they part ways as he waits for her outside as she goes in for her appointment. That's another, thing to consider when we're talking about COVID-19, where you're having to experience these often difficult medical experiences alone because you can't have somebody with you. So not just for, a miscarriage like this, but for any other difficult situation where typically you'd have a family member or your partner or a caregiver with you, it's hard to do that during a pandemic because they're not allowed inside with you. So they part ways here. She's having to get this information delivered to her while she's by herself, which is already difficult. And then she's having to give that information to her partner after they meet up again outside. So again, COVID-19 is not explicitly stated here, but it's the subtlety in just giving us a snapshot of what her real experience was like that tells us how COVID has impacted this already difficult experience. Another type of comic we see is an educational type of comic. So this was created intentionally to help kind of simplify a pretty difficult topic, which is describing the structure and how COVID-19 works. This is very different than the representation of COVID that we saw in the 3D model from the CDC artists. It's different from the infographic we saw with the narrative story arc, where there was a lot of information presented in one image. This is a comic done by Christine Sean, an artist in Toronto, called How Does the COVID-19 Virus Infect Humans? So this is definitely very engaging. The color palette is bright. There's a lot of contrast here, so we immediately know. So here it's presented as the pink virus, so we can immediately tell where it is in each panel. Even the, each definition is color coded, so it's very easy for our eyes to associate those things to each other. And this is simplified for the target audience, which is probably a younger and a more lay audience who probably has not encountered scientific definitions very often. So this really helps simplify that and engage the audience without that kind of intimidation of being overwhelmed with a lot of information at one time. I really like how this narrative is structured because you're combining information, this kind of narration for what's happening, presenting what the definitions are, along with a narrative. So you have the body of text here, along with this narrative. You have characters. You have COVID-19 as this character with a literal face, and then you have all the other proteins that are involved in this process as side characters, and there's different actions taking place. So. And it's broken down in different panels, so you really understand the reading order and the different steps being taken here. So I love how this is structured. Another form of storytelling is on the opposite end, where you can close your eyes and listen to a story being told to you through the form of a podcast. So The Nocturnist, which is a San Francisco UCSF-based podcast series by Emily Silverman, Dr. Emily Silverman, recently did a series called Black Voices in Healthcare. And this was in response to the Black Lives Matter protests that were happening during the summer, and just kind of showcasing the importance of having those Black voices and them describing their experiences in healthcare, especially during this pandemic. It's a really important series, and I urge you to go listen to all the different episodes. Today, I'm just going to show you a short clip of one of the episodes, and this is the episode 5, specifically looking at stories from the pandemic. I'm going to go ahead and play the clip before I discuss it further.
I'm a rising third-year med student. studying for STEP during a pandemic. It's funny because, 6 months ago, STEP felt like the biggest thing in my life. And I mean, don't get me wrong, it still feels pretty huge. I mean, I'm only, I'm 4 days out. I mean, what's an 8-hour test compared to a pandemic that doesn't seem to be ending anytime soon and over 130,000 lives lost? What's step one compared to not seeing my family in person for 8 months? What's step one? What's school? What's studying compared to having received a total of 5 hugs in the, 4 months now I've been in quarantine?
So that was just a short clip from the podcast series. And again, I hope you can go listen to the full episode. But this form of oral storytelling, there's a level of intimacy that you feel when you're listening to the story being told to you. You feel the inflection in their voice. You can feel the emotion that they're describing through their own experiences. There's something very powerful to that you might not get through visuals. You can apply your own imagination as you visualize what they're saying. So with that clip I showed, she's describing what we all are feeling on some level, where you already have difficult situations that you might be dealing with, whether it's taking exams, whether it's, just simply going to work, or, taking care of, a sick family member. And then COVID-19 just almost feels like it's making that whole situation so much harder. And it might feel like it's, your problems or your worries or the struggles you're going through are just not as important as this bigger picture that we're facing, with the hundreds of thousands of lives being lost, and people losing their jobs, and just it makes you feel like there's something so much bigger that you're a part of, and that can be overwhelming. So just that story, that short clip already, I feel like you'd be able to relate to that so much in whatever capacity that has context to your own life. So this type of storytelling, it's, oral storytelling is one of the oldest forms of storytelling. It's, been used for generation after generation, and there's something really beautiful to that. Another type of storytelling that was used during this pandemic is the form of animation. So I'm going to show a 2D example and a 3D example. This 2D example I'm going to show is more of a narrative. It's also to showcase a story that you might be able to relate to or empathize with. This is called My Boyfriend Died of COVID-19, and this was published by The Atlantic. I'm going to go ahead and play a short clip from this longer animation. So let me go ahead and play that. Sorry about that.
Chapter 5. Tongchen called me back in the afternoon. He went to the hospital again and was diagnosed with coronavirus. What worries me most is that, although he's in a hospital, the doctors put him under observation in the waiting room because his condition didn't seem serious enough and there were no beds available. Only patients who are no longer able to breathe are given a bed. Tongchen kept reminding me that it wasn't the hospital's fault, that there were too many patients, not enough beds, and that the doctors had to give priority to those who were more seriously ill. Chapter 6. 5th day of the Chinese New Year. Tongchen video called me. He said he had something to tell me and asked me please not to cry. He doesn't think he's going to make it. I cried throughout the entire call, seeing the man I love one step away from death without being able to grab him. I can hear the noise of my dreams shattering all at once. Our home, our wedding, and all our other dreams. Destroyed.
So this was a short clip from a longer animation, and I hope you can watch the whole thing. This was published towards the beginning of when COVID was starting to impact North America. By then, we had heard many stories coming out of other parts of the world, and this is a story from a woman in Wuhan. So by then, that area of the world had been quite affected by COVID-19, and we'd been hearing a lot in the news about this, but perhaps we weren't hearing individual stories that were coming out of Wuhan. We were just seeing statistics and this more politicized way of talking about what was happening. So stories like this and animations like this are important to kind of help us empathize with real people that were being affected by this and would go on to affect our lives here in North America in similar ways. Losing a loved one that you weren't expecting to lose, kind of dealing with not being able to see them as they're going through being sick. So this type of 2D animation, if you notice that her boyfriend was always displayed just with a mask, we didn't see any other facial features. That's important because it might help us understand that in the grand scheme of things, he ended up just being one of the statistics. He ended up being one of many people who were affected and ended up dying from COVID-19. And whereas we were able to see her features and her facial features, helps us empathize with her story as she's telling it to us. So there's a type of beauty that you get in 2D animation where you're able to display those kind of narratives and really select the kind of visual elements and emphasize certain visual elements. We were able to see text being displayed and highlighted. So you really are able to play around with that during 2D animation. And again, people might assume that 2D animation is meant more for children, it's more cartoons, but really it's able to illustrate pretty heavy topics as well and invoke that type of empathy that's really needed when we're discussing COVID-19. The last type of animation I want to show is the form of 3D animation. So this is by an incredible medical animation studio called Nucleus Medical Media. This is their animation called COVID-19 animation, What Happens If You Get Coronavirus. So I'm going to go ahead and play this clip before I discuss it further.
Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles, which merge with your cell's outer layer, the cell membrane.
This is a part of a longer animation as well. So 3D animation in medical storytelling is really important because it helps visualize complex spatial and temporal information. So you're able to see how different elements interact in space and through time, and there might be multiple elements interacting at the same time. And it's hard to achieve that through 2D animation. 2D animation is great for simplifying things down and being another form of really engaging media. But 3D animation is really useful in terms of just being able to visualize that complexity that we'd never be able to visualize otherwise. Here, it's again this kind of informed imagination where these artists at Nucleus Medical Media were able to synthesize that information that's coming out about COVID-19 and be able to visualize it in a way that makes sense in terms of the different stages that are happening. As it enters the body, we get that zoom in. We're able to see how it affects different cells, what those structures look like, what's the size difference between the virus versus our normal cells? So this is really important information to be able to visualize to a lay audience. What's interesting about this video, so this was published again towards the beginning of the pandemic and in the end of March. And it now has, around 18 million views. It might be higher every day. People are watching it. And the only reason I'm mentioning the view count on this is that clearly there's a need for information, for this kind of storytelling that people need in order to understand the complexities of what's happening. I think not knowing is very scary for most people. So just being able to be educated and by understanding what the virus is, how it affects the body, just that kind of education, I think really helps people understand why it's important to wear a mask, why it's important to social distance, because they see how it affects the body. It's a real virus, it has real consequences, and through being able to understand the step-by-step and a bit of the science behind it, even if you don't have a science background, I think helps you feel more comfortable in those decisions that you're making during the pandemic, and feel that it's important to adhere by social distancing and all those other regulations that have been put in place. So there's a clear need for compelling and informational media during most days, but especially during a pandemic like this, where there's so much misinformation happening that have real consequences, and there's so much that is left to be discovered and to be known. So I hope animations like this, or infographics, or 2D animations keep coming out as we experience COVID-19 and as this extends for the next few months. Almost as an honorable mention, I want to talk about social media. Social media is amazing in many ways, and since we've all been inside and on our computers and on our phones more during the pandemic, we're engaging with a lot of social media. My experience with social media is maybe a bit more limited to Instagram and Twitter, but there's all sorts of other types of social media outlets that are, delivering information about COVID and delivering stories about COVID. These are just a few examples. So a few that I want to show is just the short narrative, or the kind of comic reflection. So here, this is a really mini comic, and it's a bit longer, and I have these all referenced at the end, describing two different situations of people experiencing COVID-19, just looking at those disparities. So this is that kind of narrative. There's also when you interject a bit of humor into the situation. So especially in the first few stages of COVID, there was a lot of, bettering yourself and having self-reflection and, journaling and learning new hobbies. And this just is a commentary on that there's an exhaustion about that as well. Keep self-reflecting. So there's definitely some humor that comes out of these experiences. There's also the rise of what people are calling social media slideshows or social media PowerPoints, where you have multiple slides that are dense in text, which I had never really seen before the pandemic. This kind of dense information that are being presented in these small squares on either Twitter threads or through Instagram photos. It's been pretty surprising just to see the lack of visuals that are in this, and more just kind of breaking down information and people really sharing them and being able to share more information. And it's almost like receiving the news in these bite-sized pieces. So there's definitely a lot of beauty in this. I think people should always be doing their own research and reading things in more depth. But this kind of bite-sized way of delivering information, I think, has really helped people be more informed and get that kind of information they otherwise might not be getting. Again, because it's this kind of bite-sized data, bite-sized information, sometimes this can spread misinformation. So you get these infographics or graphs that people might not be fact-checking. So it's always important to go back and do your own research. But ultimately, I think social media has been a pretty important tool in terms of, getting people to wear masks and just delivering that information. So before we jump into the exercise, I want to see if anybody had any questions. Anyone can raise their hand, I think, and ask a question here or write it in the chat. If not, I can go ahead and get started with the exercise. No? Okay. I'm going to share my screen again. So this is a short comic exercise that I hope everyone will participate in. Basically, you can do your own storytelling in all sorts of different ways, whether it's journaling or just doodling or recording voice memos or whatever it is. It's always important to have an outlet for expressing these things. So today I'm just going to show you a really simple exercise on doing that. We're going to be creating a really short 4-panel comic. So we have about 20 minutes left. I think that's the perfect amount of time to go through this exercise and ask any questions that you may have. So for this exercise, the first part is to draw your panels. So if you could draw 4 panels, either through creating boxes or through dividing the page with a cross. So I'm going to be doing this along with everybody. We'll just take 30 seconds to do that really quick. Okay, so hopefully you've all drawn your 4 boxes. So the second part is to fill out this prompt. So you can do this, just has to be associated with each of the 4 panels. So either write it in the top or the bottom, wherever you want. But the first box you're going to fill out. So when I feel blank in the second box, it helps to blank. Third box, because blank, and then the 4th box, and then blank. So keep this really simple. It doesn't have to be super complex. Just whatever you're feeling in the moment or this week. I'm going to go ahead and fill out the prompt along with you all. So just take a few minutes to do that. take a couple extra seconds to finish that up. Okay, so the last part of this comic exercise, which we'll spend a bit more time working on, is the visual theme. So whenever you're creating a comic like this, it's good to understand if you want it to be more abstract. So it could just be shapes or colors or lines. It's more of invoking that, visualizing the feeling rather than any specific literal object. So you can do shapes. You can also use a metaphor that carries through what you're talking about. So here, this is the example of using a flower. So are you planting a seed? Is the flower dying? Is the flower blooming? You could use all sorts of visual metaphors, similar to poetry, just to help visualize what you're saying, but it doesn't have to be so literal. Or it could be more literal. So you can come up with a character that represents yourself, or different types of characters, literally describing what it is that you've written down visually. So, and even within all of these abstract, metaphor, or literal, you can be as simple or as complex as you want. You could have really realistic portraits of yourself, or it could be a stick figure that represents what's happening and what's being written in each panel. So I think we'll take a couple moments to decide what kind of visual theme you want, and then take maybe 5 minutes to fill out each box and create and draw out what it is you want each of the 4 panels. So I'll do that alongside with everybody, and we'll just take a few more minutes to do that part of the exercise. Let's take an extra minute to wrap this up, and I'll go ahead and share mine. It'd be lovely to have some of you guys share what you've done as well, but no pressure. Okay, so I'm going to go ahead and share an example that I did in a previous workshop where I did this exercise, and then I can stop sharing and share what I've done today. So this was an example from September. So I did the same thing. I filled out each of the prompts for the panels. So I said, when I feel anxious, it helps to take a walk because I can see the bigger picture and then feel relaxed. So I used really simple wording. This doesn't have to be super complicated. And then I ended up going with a visual theme of a more simplified literal representation. So I made a character to represent me, and I put myself in a really simple setting. And the thing that really ties even simple storylines like this is using consistent imagery that connects the panels together. So I decided to go with the theme of using trees to kind of represent my proximity to how anxious I'm feeling. So when I'm inside, I'm literally, there's a barrier between me feeling not anxious anymore. Those trees are representing that relaxed state. So they're outside, they're far away from me. When I take the conscious decision to go take a walk, here I am, I'm, making the step to remove that barrier and go outside. Then I say, because I can see the bigger picture. So here I am, represented amongst the trees. I'm very small in scale compared to the trees. So it really puts myself in perspective of I'm just part of this bigger picture. And the last panel is that I feel relaxed. I'm interacting with the environment around me. I feel like I'm now present. I'm outside. And the other thing that I did here, maybe more subconsciously, is that there's this parallel between the first and the last panel. I'm at a profile, I'm feeling anxious, my head is down. And then the last panel, I'm still at a profile, but now my head is raised and I'm smiling. So this is super simple, it's just a really short exercise, but even with these kind of smaller things, storytelling can still be effective no matter how simple or complex it is, by just having a consistent theme and just really keeping it simplified. So before I stop sharing, I just want to say thank you to everyone who's joined the workshop today, and I hope you found it interesting and informative. If you have any questions at all, please reach out to me. Here's my email and my social media, and you can find more of my work on my website. After this whole session is being recorded, so if you'd like to have access to these slides, they should be available once the recording is published on the page, and I have links to all the references and a few additional resources that I think I would have loved to include but did not have time to today. So I'm gonna go ahead and stop sharing. Anybody has any questions or would like to share the comic that they did today, I'd love to see it and discuss it. You can raise your hand in the, I believe you can raise your hand and we'd be able to promote you as a panelist so you can share your screen. If you're shy, that's okay. I can go ahead and remove my virtual background really quick so I can share the mini comic I did today. That gives you some encouragement. So the comic I did today was really simple as well. So I said, when I feel overwhelmed, and I chose a more abstract theme. So when I feel overwhelmed and I have a bunch of shapes kind of floating together, it helps to make a list. So I have the same shapes listed out here, a bit more organized. And I said, because I can see each task and then feel confident in my day. So I feel like I can tackle those tasks that were overwhelming me at first. So really simple, but it helps kind of just give you a bit of self-reflection, especially during this crazy time that we're all living in, where we're kind of overwhelmed with a lot of information at one time. So do you make books? So I have not made a book, but I have done a longer form comic that discussed my experience with my grandfather being diagnosed with cancer and just dealing with those cultural differences. I'm Middle Eastern, so there's a lot of different cultural differences that we have in how we disclose difficult information to patients and just the ethics behind that. So that can be found on my website. I can link that project in the chat if you're interested in reading the full comic. So that's the closest I've done to creating a book per se. Thank you for that question though. I'll find it and link it to you. And let me know if you have any other questions. I know we have a couple minutes before the hour, so I'm happy to stay on until then. So you can read the full comic there. I've linked it in the chat. Have you done animations before? Thank you for that question. So I've done a full-length or a 5-minute 3D animation as part of my my thesis work for my master's, and I can link that in the chat as well. And I've done a short 2D animation animating over a podcast episode. So I do love working in animation. I think it's a great way of telling stories. I'll also link the 2D animation as well. And I'd love to see the comics that you've worked on. If you don't want to share them here, I'd love if you want to email them to me. And here's the 2D animation. Yeah, so Alyssa, I sent the comic in the chat. Let me know if you can't see it. How did you become interested in science illustration? So that's a great question. I think a lot of us in the sciences, I was purely in the research sciences before pursuing this field. I wasn't doing art professionally. It was more of a hobby that I wish I could have, participated in more. And then I found out about the field of medical illustration, previously having thought it was, a dead field that, nobody was working on anymore. Like this was something that people did 50 years ago, but no one does it now. Then realizing it's a really expansive field that is always being updated with new technology, and there's so many cool things that you could do as part of it. So I thought that was an amazing combination of the arts and sciences and decided to go for it. So I'm going to link the Association of Medical Illustrators website if you want to know more about the field and if you're interested in it. Go ahead and link that.
Sarah, I'll just mention it looks like you're just sending those links to the panelists.
Oh, I'm so sorry. I did not realize that. Let me go ahead and send them again. So it's someone's asking, is animation time consuming? How long does it take to finish a project? That's a great question. Animation is definitely time consuming. Let me first send the links I've been sending to everyone. So the first link I'm showing is AMI.org, which is the Association of Medical Illustrators website, where you can learn more about this field. So the second link is a link to my 2D animation that I worked on. And I'll also link the 3D animation I worked on, as well as the comic, if you're interested in that. So here's the comic, and here is an example of 3D animation. So for the 5-minute 3D animation that's being linked as part of my research, that took almost a full year of work between researching the topic, storyboarding, creating the 3D models, rigging the 3D models, creating the renders, putting it all together. So for a 5-minute animation, when you're by yourself, it takes an extraordinary amount of time, which is why people are typically working in studios or working with other people, so you can split up those tasks a bit more. But if you're by yourself, it is very time consuming. Different types of animation work in different ways as well. So if you're doing 2D animation, that might involve something like After Effects, where you're creating shapes and you're manipulating them in a program like that. Or if you're doing frame by frame animation, you know, if you're thinking there's 24 frames a second and you're doing a minute animation, well, now you have a lot of frames to draw out individually. So it can take quite a bit of time. It's very rewarding to see something you're drawing come to life in that way. So it's all worth it in the end, I think. Thank you for those questions, though. And I know we have 2 minutes left, so if anyone has any last minute questions, I can answer them, or feel free. I'm gonna shoot my email in the chat as well. Feel free to reach out anytime. I'm happy to answer any other questions, or feel free to send me your comic that you did today if you want to share it with me. Oh, okay. Otherwise, thank you so much for joining today. It was really fun doing this workshop with you all. I hope you had a good time and learned something new and enjoyed the other really awesome events at the Bay Area Science Festival. I know it's virtual this year, but I think it's been an amazing series of events otherwise.